So I'm going to present a few cases now that I'd like you to think about and to look at, and maybe answer a few questions to yourselves, and we'll just go through each case one by one. Obviously, these will be on the web, so you can go over these later. If you think we've rushed over anything too quickly, then you can always go back and have a look. So the first case is a Cavalier King Charles Spaniel, 1-year-old female called Maggie, and Maggie was presented with a 3-week history of lethargy, coughing, and increased respiratory rate. There was no response to antibiotics or steroid medication. There'd been some weight loss despite a reasonable appetite. So 1-year-old Cavalier King Charles Spaniel with respiratory signs. Clinical examination, there was definitely increased respiratory rate and effort, increased respiratory breaths over all lung lobes, and these were the radiographs. So this is the dorsiventral radiograph. We took the dorsiventral first because we were concerned that Maggie might not like lying in lateral recumbency, and we didn't want to stress too much by doing that, so we took this view first, but she wasn't particularly worried by that, and we were able to get this second view, which shows those same sort of changes. So the question that I want you to answer, and I go back to the radiographs in a minute, is what is the predominant lung pattern? So what is the most severe lung pattern? Is it a bronchial, vascular, interstitial, or alveolar lung pattern? To give you a few seconds to look at each of those radiographs. So that's the dorsiventral, and that's the lateral. Okay, well, hopefully most of you came up with interstitial. There is some bronchial pattern. You can see some bronchial infiltration and thickening around here with some donuts and tram lines around here. But really, when you come to look at the background opacity, then it's a fine sort of nodular reticulated pattern throughout the whole of the lung lobes that gets more intense in the dorsal areas because, of course, that's the thickest area of lung tissue, so that's where you get most of the pathology. So the answer was interstitial is the predominant lung pattern, or the most severe. You're then asked which of the following differentials might you include? Eosinophilic bronchopneumonopathy, or pulmonary infiltrate with eosinophilia, angiostrongylus vasorum, pneumocystis carinii, or all of the above. And hopefully most of you would consider that all of the above could produce an interstitial or bronchointerstitial pattern like the one that we've seen. So what further tests might you employ to confirm your diagnosis? Fecal analysis, of course, would be useful for angiostrongylus. Bronchoalveolar lavage could tell you about the number of eosinophils, maybe whether there were some abnormal cells there or whether there were some larvae there. Fine needle aspiration of the lung, which might help you, particularly with pneumocystis carinii. Blood gas analysis, which could tell you how severe the problem was for the animal, how affected the interstitial tissue was in relation to gaseous exchange. So probably the answer is all of the above, because we still don't know what the diagnosis is. This is the bronchoalveolar lavage from that dog, and you can see that there are lots of cells there, and those cells contain these magenta trophozoites, typical of pneumocystis carinii. A few inflammatory cells around as well, but most of these trophozoites are in neutrophils. So there are eosinophils there as well, a few macrophages, low number of neutrophils, and lots of these magenta trophozoites in the bronchoalveolar lavage. The reason that animals have pneumocystis carinii is usually because of some form of immunosuppression, and that is often inherited in things like the miniature Dachshund and the Cavalier King Charles Spaniel. And to confirm that, we've measured IgG, and you can see that that is quite low compared to the normal dogs. So treatment with potentiated sulfonamides, that's the best treatment for pneumocystis carinii. And this is the 4 week later, the radiograph taken then with following 4 weeks of potentiated sulfonamides. You can see there's still a slight interstitial pattern, still a slight bronchial pattern, but it's considerably better. The dog's a lot better than it was prior to treatment. The lateral view has also resolved. We kept the dog on for a further 4 weeks and then stopped the treatment. There's still some interstitial pattern, which is probably residual scarring of the lungs, but much improved from the original ones, and even improved from the 4 week treatment period. So pneumocystis carinii is something that you think about causing bronchopneumonia in young dogs, usually around about less than a year of age or just over a year of age, and it is treatable, but only really responds well to potentiated sulfonamides. So you have to be quite specific about your diagnosis and your treatment. Fine needle aspiration of the lung can often reveal the trophozoites, even if you don't get them on a bronchoalveolar lavage. So it can help to do that as well. The second case is Italian Spinone, 2-year-old female called Bracken. A 2 week history of acute onset of hemoptysis. The hemoptysis was progressive over that period. The dog was fairly dull, depressed, and inappetent. Clinical examination showed dried blood around the nostrils, tachymucous membranes, tachycardia, increased respiratory rate and effort, and increased lung sounds and crackles, especially in the right middle lung lobe. The clotting time was normal in this dog, just in case you were wondering whether this might have had some form of coagulopathy. That was done before we did any further investigation to make sure it hadn't got warfarin poisoning or some coagulation defect. But these were the radiographs that we took. So there's the lateral, that's the left lateral view. The reason that we took the left lateral view as well as the right lateral view, but I'm only showing you the left, is because the pathology seems to be mainly, or the severe pathology seems to be on the right-hand side. So have a look at those radiographs, see what changes you can find. Jot those down on a piece of paper, and then I'll tell you what I can see on those radiographs. Okay, so if we start off with the dorsoventral view, then you can see the outline of the thorax. There's quite a degree of symmetry of the ribs, although there's a slight rotation of the chest. But the most outstanding feature is this consolidation on the right side in the middle lung lobe area. The cranial lung lobe less affected, a little bit of air here suggests that it's only partially consolidated, but much more pathology here on the right hand side, although all the lung lobes have some bronchial pattern around here.